While the search for a vaccine goes on, all medicine can do is treat the symptoms of COVID-19 infections and allow a patient's immune system to fight the virus. Now, several treatments are being explored. One of these includes a common painkiller, ibuprofen. A team of researchers from London's Guy's and St. Thomas's Hospital and King's College are running a trial called Liberate to see if the medication could treat breathing difficulties in COVID-19 patients. Dr. Ndaba Mazibuko is the lead co-investigator for King's College London for the Liberate trial. He joins us now live from London. Good evening, and it's a pleasure to have you on The Pulse tonight. Perhaps let's just begin with the background. What is Liberate?
Thank you for having me. It's a pleasure to speak to you this evening. So Liberate is a trial for a therapeutic drug as a treatment for COVID-19. So essentially what this drug attempts to do is to clear out the inflammation that builds up in the lungs. So one of the problems with the COVID disease is that when people get breathing difficulties, what's actually happening at that point is their lungs are filling up with inflammatory material where there should have been gas exchange or air. And so the idea of this drug is to remove that so people can then breathe once more.
Ibuprofen, of course, is a commonly and widely available painkiller. One would think that if it had miraculous powers, they would have been discovered by now. So what don't we know about ibuprofen that has caught your interest?
That's a very good question. So this is a special formulation of ibuprofen, so it's not the standard ibuprofen that most people will be able to find on the pharmacy shelf. So it's been reformulated in order to get better access to the tissues inside the body. And essentially, that makes it safer. That's the first thing. But also it means that there is a greater chance of this drug removing that inflammatory material in the lungs. So I know that there have been some early reports at the beginning of the COVID scenario in February about difficulties with normal ibuprofen, and this is a very different situation. So this is not using it in the community as you would use normal ibuprofen. This is using it in the hospital setting with patients who are at a very specific stage in the disease, a stage that sometimes is referred to as a cytokine storm. So these are the people that we're treating. So these are hospitalized patients, and the idea is that we're stopping them from escalating to the point where they need intensive care treatment and ventilation.
When will these trials be run, and is it going to be trials that are run just by the associated institutions, or are you looking at running different trials in different countries?
So we are beginning the trial in the next week in the UK, as you correctly stated, Guy's and St. Thomas's Hospital as part of King's College London. So we have the necessary approvals and the green light to start in the UK, but we are looking for international partners. So we've reached out to people in various parts of the world, including in South Africa. We're already in early conversations with clinicians and researchers. So we're very hopeful that we can engage with people in South Africa to extend this, because we think this would be a really worthwhile investigation and possible treatment for people everywhere.
How soon before we know if, in fact, it's something that could work to treat COVID-19?
So this is a drug that actually, the results would be quite apparent quite quickly, actually, in terms of it producing an effect. It's going to work in the way that we expect and hope that it will work. So, you know, when the data suggests that when people get this drug, typically you should be able to see a change in a matter of hours into a few days. So the trial itself would run for a period of 60 days in total to gather that information. But actually we should see at least early results within a matter of days. And our first interim analysis is of 20 patients, but actually up to day 14 is where we would expect to see the changes in the respiratory function or those lung changes if this drug is going to show a response.
Sure. One of the things that we're seeing now, of course, are different trials that are being, again, held in different countries, all exploring various options. I wonder how much information sharing is taking place within the medical community about these different trials and some of the results that are coming out of them.
So there is quite a lot of community sharing within the professional, clinical, and academic arena, and I think there has to be. It's very important that people do have a combined understanding of what's working, what's not working, and we see our job as trying to promote that as well. I think a lot of the information sharing at this point has been happening within countries. So within the UK, we have what's called platform studies, where hospitals across the country all share the same studies, essentially, and the same data. But actually, I think a lot more of this could be happening internationally, and that's part of what we see as our brief to engage with countries like South Africa and others to share that even more broadly.
All right, let's leave it there for tonight. Dr. Ndaba Mazibuko there of the King's College London.